extraction is a common dental procedure that involves the removal of a tooth from its socket in the jawbone. Although dentists strive to preserve natural teeth whenever possible, there are situations where extraction becomes necessary to maintain overall oral health. This video will take an in-depth look at the reasons for tooth extraction, types of extractions, the procedure itself, aftercare, potential complications, and ways to avoid extraction when possible. Why tooth extractions are necessary. Several situations may lead to the need for tooth extraction. Understanding these causes can help in preventing the need for future extractions. 1. Severe tooth decay. When tooth decay extends deep into the tooth and reaches the pulp, the inner part containing nerves and blood vessels, the tooth can become irreparably damaged. Root canal therapy is typically the first option for saving the tooth, but in severe cases where the infection has spread, extraction might be required to prevent further damage and infection from spreading to other areas. 2. Gum disease, also known as periodontal disease. Advanced gum disease weakens the structures that support the teeth, such as the gums and the bone. If gum disease is left untreated, it can cause teeth to become loose, and extraction may be required if the tooth cannot be stabilized through other treatments like deep cleaning or gum surgery. Tooth trauma. Teeth that have been damaged due to trauma, such as a sports injury or accident, may need to be extracted if they are fractured beyond repair. In some cases, if the tooth root is compromised, the damage cannot be repaired, and removal is the only option. Overcrowding. In some cases, extractions are recommended to create space in the mouth for orthodontic treatments, such as braces. Overcrowded teeth can prevent proper alignment, and the removal of one or more teeth may be suggested to allow the remaining teeth to shift into the correct position. Impacted wisdom teeth. Wisdom teeth, the third molars located at the back of the mouth, are often impacted. When wisdom teeth cannot fully emerge due to lack of space or poor positioning, they can cause pain, infections, and damage to neighboring teeth. Impacted wisdom teeth are one of the most common reasons for tooth extraction, especially in young adults. Infection or abscess. If an infection or abscess forms around a tooth that cannot be resolved with antibiotics or other treatments, extraction may be required to eliminate the infection and prevent it from spreading to other parts of the body. Tooth extractions can be classified into two main categories: simple extractions and surgical extractions. Simple extraction. A simple extraction is performed on teeth that are visible in the mouth. These extractions are typically quick and can be completed under local anesthesia. The dentist uses an instrument called an elevator to loosen the tooth and forceps to remove it. Simple extractions are most commonly performed on teeth that are not severely damaged or impacted. Surgical extractions are more complex and are performed when the tooth has not fully erupted or has broken off at the gum line. Surgical extractions may require the dentist to make an incision in the gum to access the tooth. In some cases, the tooth may need to be broken into smaller pieces for easier removal. Surgical extractions are more common with impacted wisdom teeth or teeth that have been fractured. Understanding what happens during a tooth extraction can alleviate anxiety about the process. Here's a step-by-step overview of what to expect. Before the extraction, a thorough dental examination will be conducted, which may include X-rays to evaluate the tooth and the surrounding structures. The dentist will assess the complexity of the extraction and discuss the treatment plan with the patient. Local anesthesia is used to numb the area around the tooth, ensuring that the patient feels no pain during the procedure. In more complex cases, or when the patient is particularly anxious, sedation or general anesthesia may be offered. For a simple extraction, the dentist uses an elevator to loosen the tooth from the socket. Forceps are then used to pull the tooth out. For a surgical extraction, the dentist may need to make an incision in the gum, remove bone, or break the tooth into smaller pieces for easier removal. Once the tooth has been removed, the dentist may place a gauze pad over the site to help control bleeding. In the case of surgical extractions, stitches may be needed to close the gum tissue. Proper aftercare is crucial for healing after a tooth extraction. Here are some key aftercare tips. A gauze pad will be placed over the extraction site to control bleeding. Patients are advised to bite down on the gauze for about 30 minutes to help form a blood clot. Discomfort is common after an extraction, and pain relief can be managed with over-the-counter medications such as ibuprofen. In cases of surgical extractions, stronger prescription painkillers may be recommended. Swelling is normal after a tooth extraction, especially with surgical extractions. Ice packs can be applied to the outside of the face for 15 to 20 minutes at a time to reduce swelling. Physical activity should be limited for the first 24 to 48 hours after an extraction to avoid dislodging the blood clot, which can lead to a painful condition called dry socket. Soft foods such as yogurt, applesauce, and soup should be consumed for the first few days. Hot, spicy, or crunchy foods should be avoided to prevent irritation at the extraction site. Oral hygiene is crucial, but for the first 24 hours after a tooth extraction, it's important to avoid brushing the extraction site. After this initial period, gentle rinsing with warm salt water can help keep the area clean without interfering with the healing process. Although tooth extractions are generally safe, complications can arise in some cases. Here are some potential issues to watch for. One of the most common complications is dry socket, which occurs when the blood clot at the extraction site is dislodged or fails to form. This leaves the bone and nerves exposed, causing severe pain. Dry socket can be treated by the dentist through the application of medicated dressings. Infection at the extraction site is rare but can occur, especially if proper aftercare is not followed. Symptoms of infection include fever, swelling, and pus at the extraction site. In rare cases, nerve damage can occur during the extraction, particularly in lower wisdom tooth extractions. This may result in numbness or tingling in the lips, tongue, or chin. In most cases, nerve damage is temporary, but permanent damage can occur in very rare cases. While some extractions are unavoidable, many can be prevented through good oral hygiene practices. Here are some ways to reduce the risk of needing a tooth extraction. Regular brushing and flossing help prevent tooth decay and gum disease, which are leading causes of tooth extractions. Routine dental checkups allow for early detection of problems before they worsen. Wearing mouth guards can protect teeth from trauma during sports or physical activities. A balanced diet, rich in vitamins and minerals, supports healthy teeth and gums. Tooth extraction is a common dental procedure that may be necessary for a variety of reasons, including severe decay, gum disease, or trauma. While the process may seem daunting, understanding the reasons, procedure, and aftercare involved can ease anxiety and promote a smooth recovery. By maintaining good oral hygiene and visiting the dentist regularly, the need for extractions can often be avoided. If an extraction is required, following the dentist's post-procedure instructions carefully will help ensure a quick and comfortable recovery. For more dental information, log on to smile-y.co.in.